Hello, and welcome to UC Davis Continuing and Professional Education's Public Health Information Session. My name is Tiffany Thompson, and I'm one of the enrollment coaches. If at any point at the end of this webinar you have any questions, feel free to reach out to our team at cpecoach@ucdavis. All right, let's go ahead and get started. As an enrollment coach, I want to start off by giving you an agenda of what we will go through and what we will be covering in this presentation. We're going to start off with hearing from Dr. Brad Pollock, the Chair of Public Health Sciences, to give a brief program overview. Then we're going to dive into program audience, who is this for, the program structure, how to get started, the cost or finances and discounts, and the next steps. So let's go ahead and hear from Dr. Brad Pollock.
Hi everyone, I'm Brad Pollock. I'm the chairman of the Department of Public Health Sciences at UC Davis. I'm a professor and a cancer epidemiologist. I'm also a public health educator. There's been a surging demand for public health services as we transition out of the COVID-19 pandemic. The pandemic highlighted the growing need for public health professionals, and right now we only have about a fifth of the public health workforce needed in this country. In addition to COVID and other emerging infectious diseases, there are a variety of other health challenges, including those that are related to our aging population, to advancing climate change and environmental impacts, to increasing barriers to accessing health services, and to diseases that are influenced by social, economic, and lifestyle factors. I'd like to explain a little bit about our UC Davis Public Health Certificate Program. We have a one-year part-time program that's been designed for working health professionals. The goal of the certificate is to increase the skills and knowledge of current and future public health professionals. For those who will not pursue advanced graduate degrees, our courses will increase your expertise in public health. They provide a bridge to public health-related master's degrees. To briefly explain what you get out of our program and where it can take you, our certificate includes graduate-level public health courses that cover the essential areas of public health, and these include epidemiology, biostatistics, the organization of health systems, and social and demographic determinants of health. You will master the competencies required for accredited Master of Public Health degree programs. All of our courses are offered as online asynchronous classes so that you can keep your day job throughout the program. Career options include working in government health agencies, working for health provider organizations, working with community-based organizations, and with additional advanced degrees, they will prepare you for academic jobs at institutions of higher education. For those of you already working, I think the certificate will expand your options for promotion and advancement within your organizations. There are so many career opportunities. It has never been more apparent how essential public health is to address some of our big health challenges and to keep the population healthy. The work we do is important for our communities. It'll be a very long time, I think, before we'll even start approaching the point where we have the needed number of new public health professionals. UC Davis is one of the top-ranked public universities in the U.S., and our public health graduate program is in the top tier. We would really love to have you come and join us for our certificate program.
All right, so as Dr. Pollock mentioned, there is a wide variety of careers that you can explore upon completion of our program in combination with your existing position or experiences. Some including a health program manager at the state and county level, a health policy analyst, which is somebody who works to evaluate current and potential policies regarding health and healthcare in your community or organization and looking at its impact, or a community program manager. So maybe you're interested in implementing and developing initiatives at the community level, working with low-income families, minority groups to provide information about healthcare services and resources regarding their health and well-being. Or a health educator or patient educator. This is somebody who works to educate people about behaviors that promote wellness and share information about the availability of healthcare services. Or a research and data analyst. This is someone who collects and analyzes data for others to make decisions and observations about population health. All of these are occupations that result from this type of formalized education. Before we get into program structure, let's discuss audience. Who is this certificate for? We have three main audiences that we serve with this certificate. current public health professionals looking to advance their careers, career changers who want to explore a future in public health, or recent graduates who want to be competitive for MPH programs. So first, our current public health professionals looking to advance their career. We designed this program with you in mind. This is part-time, one class per quarter, and it really allows you to focus on the content for 10 to 11 weeks and engage with the material without having to forfeit your current career and commitment. With skills learned in epidemiology, social and behavioral health, and population health, you'll be able to do your job better and help lead your communities. When going about creating this certificate, we received input from a diverse group of individuals who serve as our advisory board, all who were mindful and intentional about the kind of classes that they would like to see and the modality of it. They range coming from private and public sectors who really gave input on what someone from this certificate should be learning for industry success. For those that are considering a move to public health, but they can't afford to commit to a full-time degree just yet, we have this certificate with you in mind. Let's say that you want to be able to see what the curriculum is like and what you will be learning before making such a big investment. That's definitely understandable. So our certificate is designed for you and it allows you to keep your day job while taking classes with us, and it does not cost nearly as much as a graduate program. It'll also allow you the opportunity to transfer units into the UC Davis MPH or Masters of in Public Health upon acceptance into that program if you would like to go further and receive your graduate degree as well. So it's a great perk of the program. Our certificate gives you the foundational knowledge that you need to jumpstart your career in public health and allows you to connect with the faculty, industry experts of the field, and also your peers in the class. Or maybe you're a recent graduate who wants to be competitive for the MPH program. But you just need to demonstrate to the admissions committee that you are public health focused and ready to take on this degree. While this certificate does not guarantee acceptance into the MPH program, your participation in the certificate demonstrates your interest and commitment to public health. A great aspect of this program is that because it was built in partnership with the DPHS, or the Department of Public Health Services, we have aligned the curriculum almost exactly to the courses in the MPH degree. That being said, if you are accepted into the MPH program at Davis, these units do matriculate and transfer directly into the program. So let's go ahead and go into program structure. There are 4 classes in the certificate, and each course will be 10 weeks long. Because UC Davis is on the quarter system, we too operate in the same way. This means if you are used to a semester system-based school, you'll need to be prepared for how quickly quarter classes run. All classes are online, asynchronous, with built-in live components that will be optional to the learner. This is because we specifically made the certificate to cater to working professionals. We know that you have lives outside of school and are likely working full-time, so we want you to be able to successfully learn on your own weekly timeline. This certificate ranges in how it's assessed, meaning that you will have a variety of lecture videos, readings, assignments, and exams. So you will need to be prepared to take on that workload from week to week as you progress. As a reminder, these are graduate level courses, so be prepared to study and ask questions. This program is not designed to be finished in 12 months. You take one course per quarter. There are 4 courses in the certificate. Each course is offered one quarter out of the year. This means that if you skip that course in the sequence, you will have to wait an entire year to take it again. So I would recommend sticking it out for the entire year. These don't have to be taken in any specific order. In the summer, the course is epidemiology for healthcare professionals. In the fall is social and behavioral determinants of health. In the winter is introduction to health science statistics, and in the spring is health services administration. Next, we're going to hear from Dr. Marcela Gonsalves.
Hi everyone, I'm Dr. Marcella Gonsalves and I'm faculty for a public health certificate. In this video, I'll describe our 4 courses in the certificate and what you can expect to learn as a student. Our first course is Epidemiology for Health Professionals. This course will provide you with the foundational skills and approaches to identifying, understanding, and addressing disease outbreaks. These are very important skills for public health professionals. You'll learn about the major causes of deaths, injuries, diseases, and illnesses in the U.S. to better understand the major health burdens that we face. In epidemiology for health professionals, you will become like disease detectives and learn the essential skills that epidemiologists use to do their work. For example, you learn about the different tests and study designs to describe diseases, injuries, and illnesses. You'll also learn about how epidemiologists work with others in public health and outside of public health to address public health burdens. Our next course is Social and Behavioral Determinants of Health, and in this course you'll learn about how health doesn't just happen in one place like a doctor's office. It's the result of many different factors where we are born, live, learn, work, play, worship, and age. In this course, you'll examine many of those factors, including topics like race and ethnicity and policies, to analyze their effects on health. This is important information to know because it can help you understand the complex systems that public health is situated in and how and when to intervene. Our next course is Introduction to Health Science Statistics. In this course, you'll learn about the mathematical skills that drive the evidence we use in public health. You'll learn how to take a data set and conduct quantitative analysis to derive the appropriate results for your given issue or question. You'll also learn about different types of analyses, including descriptive statistics, statistical inference, and the underlying concepts for these tools. You'll also use commonly used statistical software to conduct your analysis. This is an important skill that many public health professionals have to use on a day-to-day basis. Our last course in our public health certificate series is our Health Services Administration course. In this course, you'll learn about the healthcare system in the United States, its structure, how it's funded, and its relationship to the public health system. This is really important to know because healthcare is a very important part of the public health system and the way that we improve and protect the public's health. You'll also learn about the legal and ethical underpinnings of public health and the healthcare system, as well as important concepts, theories, and skills that you can use to lead and manage a health services organization or a health organization.
All right, so while these are not required, we have certain recommended prerequisites in order to succeed in the program. We recommend having prior coursework in statistics. This really is going to give you a good baseline to work from for epidemiology and also the health sciences statistics course. We do provide stat resources that can be found in the questionnaire you fill out when you register for classes. We also recommend a familiarity with SAS programming. You will touch on this in health science statistics, so again, having this background is very helpful. And last, we recommend a bachelor's degree in English proficiency. These are graduate level courses, so understanding that they are held to a certain rigor will be expected. We do offer in the fall quarter a non-academic SAS course that really gives you the basics of what SAS is and a prep before you enter into health science statistics. That will be offered in the fall, right before the health science statistics course, which is in the winter, and it's $100 to take that. So let's go through the finance and discounts. So the cost of the program, if you pay in full all 4 courses up front, you will receive a 10% discount on tuition, which brings your total cost to $8,996. If you pay per course, it's $2,449. All 4 courses will total $9,996. Textbooks and course materials are additional, and you can expect to spend between $600 and $800 on textbooks. Some of the different options for funding is loans and training funds, job training funds, veterans education benefits, GI Bill, or a Sallie Mae Smart Option student loan. If you have any questions about financing or benefits, please reach out to Student Services at cpeinfo@ucdavis.edu, or you can call at 530-757-8777. So what's next? How can you get a discount? You can either pay in full, which is one of the best discounts that we offer, and that is a 10% discount. If you are part of a group, an organization that is sending several students, you can reach out to the student service team and you will receive a 10% discount or an alumni discount of 10%. Only one discount can be applied, so you aren't able to stack on discounts. All right, so if you are ready to enroll, you can enroll at cpe.ucdavis.edu. You can also enroll by phone at 530-757-8777. Our staff are available for enrollment between 8 and 4:30, Monday through Friday, Pacific Standard Time. If you have any additional questions and you would like to email our team, feel free to reach out to us at cpecoach@ucdavis.edu. All right, well, thank you again for attending this information session, and feel free to reach out to CPE Coach if you have any additional questions. You have a great rest of the day.